ease the lockdown or tighten the lockdown? That's the question most governments are grappling with around the world. How do we decide? Imagine a tap, water flowing out. The water is the number of new cases, new infections every day. We can control the flow by turning the tap, by tightening you're tightening the lockdown or you're loosening the lockdown. There's a bucket underneath, and the water's flowing into that bucket, and that bucket is the healthcare system. You can have a big bucket, you can have a small bucket. Different countries have different healthcare capacities, different size of population. My city, Karachi, has about 1,000 ICU beds and 200 ventilators, out of which 300 ICU beds and 76 ventilators have been dedicated to COVID patients. And there's still spare capacity in both. The bucket, the water inside the bucket, is what we call the active cases. That is, cases where we are awaiting an outcome. In 98% cases, that will be full recovery in 12 to 15 days. And in 2% cases, it will not be recovery, it will be the fatality rate. So there's also a hole at the bottom of the bucket, and that is the rate of resolved cases, meaning there's either been a recovery or there's been a fatality, and in either case, that amount of water or those amount of patients are leaving the healthcare system. Now, there's an equilibrium. The equilibrium is when the flow of water coming in is equal to the flow of water flowing out. We have a bucket where the water level remains steady, and that is when we say we have flattened the curve. If, on the other hand, you loosen the lockdown too much, you risk filling up the bucket and overflowing. And that is the number of patients that will be refused or that will not be able, the healthcare system will not be able to accommodate. And then you have to apply a triage process of who gets it and who doesn't. There are various criteria countries apply to decide on such decision, on triage decisions. And that, friends, is the framework I thought I would leave you with when we grapple with such questions of public policy. You have a nice evening.